So I just had treatment about 4 days ago, so I am so tired. It's just that fatigue, you guys get it, where you just feel like you're walking through quicksand and there's not enough sleep that'll make you feel like you have energy. There's not enough shots of espresso in your latte. It is just this overwhelming, just tired. And for me, going from being a marathon runner to a stage 4 cancer patient has just been such a big transition.
For me, I've had two different types of fatigue. One was when I was having chemo, and I was on a really high dose type of chemo, and so I would have about a week of treatment where I was just unconscious, basically, for a week. And I would sort of wake up at the end of it and be like, what happened? Where am I? What day is it? And then there's the fatigue that I have now, because I'm not having chemo at the moment, but I'm on all sorts of other medications that cause fatigue. And so for me now, it's like I'm okay in the morning, and then I get to about 2 o'clock in the afternoon, and I'm just done.
When I do my chemotherapy treatments, usually on a Monday, around 3 days later, I am so fatigued. I'm very tired, where I can barely get up to go to the restroom, take a shower. So my fatigueness usually lasts me about 4 or 5 days. And by the time when I'm feeling better, I'm going back to chemotherapy treatment.
It amazes me how I can wake up completely energetic when I think that I have all this energy to get life done, take the baby to school and run errands, and I get her to school and then I'm too tired to even go pick her up. I have to have my mom do it.
It's strange to feel, people hear tired and they don't really understand what it's like to be tired every day for the rest of your life. That's kind of overwhelming and depressing, and I find that the depression and the fatigue feed into each other, so you have to definitely manage both sets of symptoms.
So the symptoms of fatigue are very subjective. Patients sometimes describe fatigue as feeling tired, feeling weak, having not enough energy to do what they need to do, or just worn out.
In my opinion, there is a difference between being tired and being fatigued. Being tired is something that happens to all of us. If we had a strenuous day, or at the end of the day, we might say we're tired, but with rest, things get better. We actually return to a more, quote, normal baseline. Being fatigued, though, is a more continuous process that even after that rest period, it doesn't get better. In fact, it tends to prolong, or it tends to just last. Fatigue ends up being yet another barrier that they need to figure out how to work with, in addition to just treating the disease itself. And it can be quite difficult.
So how do you guys deal with fatigue? Is there anything you found that's helpful that makes it so that you can cope better with the fatigue?
I think I've been exploring some different ways of dealing with my fatigue after being diagnosed for so long, and I've really found acupuncture to be something that's been helpful.
Managing my diet seems to help. I juice a lot, and I've noticed when I don't juice as often, my fatigue is more intense. So I believe that has helped. And exercise. And I was really against that in the beginning because I thought I'm already tired, but it does help. Exercise does help. It gives me a boost of energy.
I started doing yoga, which I'm completely not the yoga type at all in any way, shape, or form. So I used some YouTube videos to do yoga at home because, I'm not up for going out to someplace.
Well, my doctor, she also prescribed me Ritalin. She said in kids, it kind of calms them down, but when you're doing chemo for the fatigue, it kind of lifts you up. So it works well.
The strategies for fatigue can be anything from medications to lifestyle changes to mind-body maneuvers. And we know from very nice data that physical activity not only reduces fatigue, but it helps sleep and improves quality of life.
So some of the strategies that I suggest to our patients when they're dealing with fatigue is, let's get to the root of the problem. And let's make sure that it's not a medical condition that's profound or increasing their level of fatigue, such as anemia. A lot of our treatments cause anemia. Drugs like Ritalin or Provigil may be beneficial for some people with fatigue and memory cognition changes.
My oncologist asks me about side effects like fatigue every time I go into his office. So we've talked about fatigue.
Well, it's great to hear that you guys have been able to talk to your doctor about this, because it isn't something that we've really discussed as far as like options. I think it's just a given with her that I'm going to be tired going through treatment, or we're more focused on where my cancer is progressing or where my lab counts are. So it's nice to even think that I should be having this conversation, that there are some other options that we could be discussing, because it's kind of just gone by the wayside in my conversations so far with her.
I think it is the job of clinicians, I don't mean just doctors, but our nursing staff, even our social workers, to pick up on those cues and give a sense of what that might be. There's some power in being able to tell someone, I think this is your diagnosis. I think you have fatigue.
It definitely has impacted how I feel about myself when I'm too tired to do anything. Sometimes I don't feel like I'm a real mom because I can't spend time with the kids. I'm too tired. I've had to learn to connect with them while I'm laying in bed, or, we watch a lot of TV because it's something that we can do as a family.
Definitely the parenting. And keeping up with my 4-year-old has been hard. I do my fair share of parenting from the couch. Puzzles and movies and the iPad, which I hate because I definitely want to be more active with her.
Being fatigued has affected my life in a major way, being a mother and a wife. I mean, even with my husband, having sex, our sexual life is different. And it's sometimes that I look at him and I'm like, how can you be with me? Because you deserve better. It's really hard sometimes to know that you can't do the same things that you used to do a couple of years ago. And I just can't help it because of the chemo taking away everything.
When you're not able to like have kids and be a mom and you're not able to work, it's really interesting to try to define your meaning when you're just laying on the couch watching the Kardashians and feeling like you're a valuable member of the world still, but you're just too tired to go do anything but that.
I think fatigue has taken away my social life. I see my friends and I see them on social media, Facebook or Instagram, and they're out. And I think a year ago that was me. And I'm not allowed to be impulsive. It makes me feel like less of a person.
I think my best advice is just to not beat yourself up over this fatigue and know that you're not alone in feeling that way.
It's okay to rest when you think you need to rest. And the best way to deal with it is to face it and learn your body.